Welcome, welcome to KSPA, the National PA channel. I'm Megan Stern. We are aware that many of you out there are unaware of what a PA is and what a PA does. Over the next few minutes, you will hear an interview with members from the class of 2017 and the class of 2018. Sit back and enjoy as we share a sneak peek into the PA profession.
What is the role of a PA in healthcare?
The PA's role in healthcare is that of a medical provider who works in collaboration with a physician and other members of the healthcare team. Upon undergoing rigorous medical training based on the medical model, PAs are capable of conducting physical exams, diagnosing and treating illnesses, ordering and interpreting tests, prescribing medication, performing medical procedures, counseling patients in preventative healthcare, and assisting in surgery. Currently, there are more than 115,000 certified PAs who are licensed to practice in all 50 states.
In what areas do PAs interact with patients?
PAs interact with patients in all medical settings. PAs are certified in general medicine, providing a foundation that allows PAs to practice in a variety of medical and surgical fields. Therefore, you can expect to see a PA in hospitals, outpatient clinics, community health centers, school or college-based facilities, nursing homes, and correctional institutions. The largest employer of PAs is the U.S. Department of Veteran Affairs.
What educational background is required for PAs to practice?
Applying to become a PA is highly competitive. For example, our program receives almost 600 applicants a year for only 40 slots. The majority of candidates to PA programs also have a bachelor's degree and have completed prerequisites in chemistry, physiology, anatomy, microbiology, and biology. Additionally, many applicants have previous healthcare experience, such as medical assistant, emergency medical technician, or EMTs, lab assistant/phlebotomists, nurses, emergency room tech, and many other areas. There are currently 226 accredited programs in the United States and more in the process. Most programs are approximately 27 months in length and consist of a year of didactic studying and a year of clinical learning across all major medical specialties. These specialties range from family medicine, internal medicine, obstetrics and gynecology, pediatrics, general surgery, emergency medicine, and psychiatry. Once a student completes the program and graduates, they will take their certification exam, which is the Physician Assistant National Certifying Exam, or PANCE. Upon passing the PANCE and completing the program, PA students are then able to pursue licensure.
What are a few pieces of equipment that are used in PA practice?
PAs utilize a variety of equipment depending on their practice setting. The main piece of equipment that all PAs carry is a stethoscope. Other equipment ranges from basic tools such as otoscopes, ophthalmoscopes, and blood pressure cuffs to specialized equipment.
What are a few examples of diseases that PAs deal with, and how do they treat them in specific relation to the case presented?
Because PAs work in various areas, PAs treat patients with all types of diseases. Again, the primary diseases treated depends on practice area. Examples of this include urgent care PAs who treat upper respiratory infections, strains, sprains, acute fractures, etc. Family medicine and internal medicine PAs primarily treat hypertension, diabetes, and hyperlipidemia. Orthopedic PAs treat sport injuries, osteoarthritis. Neurology PAs treat neuromuscular diseases such as Parkinson's, Huntington's, and essential tremors. They also deal with numerous cases of TIAs and CVAs. If you specifically look at the case study presented today, a PA could intervene in all aspects of this patient's care. As this patient presented to the ED, a PA may be the first in line in evaluating the patient. They would be responsible for asking the needed questions, for ordering the appropriate lab and imaging, diagnosing the patient, and ordering the appropriate consult to get the patient to the OR. If there was a neurosurgical PA on call, they may provide evaluation and treatment as well as first assist in the OR. Once the patient is transferred to the ICU, a hospitalist PA may be responsible for the care of the patient and of ensuring all comorbidities are controlled. If there were any complications or needed services to assist in the improvement of the patient, then the PA will be responsible for consulting the correct service needed. They would also be responsible for keeping the family informed of what status of the patient and if there was a change in the status. Once the patient was transferred to a rehab facility, a PA working in the facility may now take over the care of the patient there.
Thank you for listening in on this interview. I hope you've learned about the PA profession. Now back to our scheduled program.